warm welcome to the program. I am Mary Kanu. Nearly 800 diphtheria cases have been confirmed in Nigeria as of June 30th. The Nigeria Center for Disease Control announced the outbreak of the disease in the Federal Capital Territory following the first case and death of a 4-year-old child in June. According to the NCDC, a total of 80 deaths have been recorded among all confirmed cases, while there have been multiple outbreaks across the country since December 2022. According to the NCDC, Kano State accounted for most of the confirmed cases, while other states are Lagos, Yobe, Katsina, Cross River, Kaduna, and Osun states. The Ministry of Health has urged Nigerians to make conscious efforts to avoid contracting diphtheria, saying that everyone is at risk of being infected with the disease, especially children under 5 and adults above 60 years. The Ministry's Health Promotion Department has also issued a health advisory asking Nigerians to be cautious and protect themselves. Health experts say a strategy of contact tracing and early identification of individuals with symptoms needs to be adopted. Well, let's discuss this further. I'm joined by our Special Registrar, Internal Medicine, Federal Ministry Center, Bida, Niger State, Dr. Iriwolide Bello, to tell us more about this disease. Thank you very much for joining us. Now, Doctor, the first question on the minds of many Nigerians would be why? Why is the country witnessing an outbreak of diphtheria, even deaths?
Yes, the country is witnessing an outbreak of diphtheria, and the reason for that is not far-fetched, is a reflection of the crawling nature of the health, our health sector, and also the fact that of a vaccine preventable disease, it shows that something went wrong. Something went wrong, usually failure of the health system. The statistics have shown that truly there is an outbreak, because right from December 2022, last year, when the first few cases were reported from Kano and Lagos, we've been having reported cases even up to today, including recording deaths, confirmed cases and recording deaths. And it's not far-fetched. It just shows how ineffective, it underscores how ineffective our vaccine, how the vaccination in the nation have been. And it also underscores how the health sector as a whole actually has been crawling, because there are a lot of things to look at. Are we able to reach people effectively? Do people believe in these vaccines? Are they not still myths that are going on here and there? Are there people we are missing people at vital points, antenatal points? Are people still making use of the antenatal? Then there are certain schemes that are no longer possible because of several insecurities, the unrest in the Northeast, the different sit-at-homes and different policy happening in the in the South. And then when you look at everything, you discover that vaccination has been very ineffective. We are missing people at critical moments, at antenatal points. People are no longer able to access quality health care because of cost of transportation, failure of the PHC. So there are a lot of there are a lot of reasons why this outbreak has come to play. But the outbreak is actually a report card to us that we are not getting something right.
All right, now some health experts, have said the 2023 outbreak is as a result of widening gap in immunization coverage. What factors do you think are responsible for this gap?
All right, thank you very much for that question. You see, whenever there is an outbreak, like I said, of a vaccine preventable disease, two things are brought to bear. One is that the people are not getting the vaccine. That is, the people are not reachable, and that may be because the people are not available, or the people to reach the people are not available. And in the case of Nigeria, if you would X-ray for people's concern, in quote, you discover that people tend to pay less attention to their health. And that is the case when we have been having a lot of insecurities here and there. There are a lot of economic policies that seem to be biting up on the people. And so these are not times when people are thinking, let me go to the hospital unless when they feel it's necessary, when somebody's really sick. These are not time when people take health jingles seriously and all what. Then when we talk about people to reach out to the people, what are the states of our hospitals, especially the primary primary health centers, where should be like the foot soldier reaching out to even to the communities. Then we have the mobile immunization scheme, which seem to have gone extinct. You no longer see the mobile immunization scheme available. And that also underscores where are the health workers. A lot of people are running out of the country. You are no longer seeing health workers, even down to the tertiary institution. They are struggling to have workers to keep up with the demand of the health need of the people. And so all of this have come into play to project or to put us in this state where we are facing another epidemic in another vaccine preventable infection. Thank you.
Well, let's discuss diphtheria transmission in layman's terms. Could you break down the facts of this serious bacterial infection?
Yes, diphtheria is an organism, a bacteria that diphtheria is caused by a bacteria rather that has some affinity for the respiratory system. That is the system that controls our breathing in and out, the respiratory tract. So usually one of the commonest ways by which it's spread is that it is airborne. From droplets that comes from cough, sneezing. When we talk about droplets, we talk about aerosol products from coughing, sneezing, talking, aerosolized product, I mean, from coughing, sneezing, and these things, once it gets from an infected person to a non-infected person, the person can get infected. And also, diphtheria can manifest as skin infection, as a wound ulcer. And so when secretions from these ulcers is being handled by someone that is non-infected, the person can also be infected. So basically, there are two major ways. One that is airborne, and then the second is from secretions of its ulcers. If someone come in contact with those secretions, then the person can be infected. That's one of the things that put health workers at great risk.
Well, we'll have to take a break now. So let's take a break. But when we return, the program will continue. Join us again. Welcome back. On this edition of the program, we're speaking to Dr. Iriwolide Bello on possible ways to stop the spread of diphtheria, which, according to the Nigeria Center for Disease Control, has claimed 80 lives. Now, Doctor, this year alone, the disease has affected 21 of the 36 states. The NCDC says, Kano and Lagos, the two largest and most commercially active states, have the highest number of cases. Does this indicate the potential for the virus to spread faster across, the entire country, if not promptly contained?
Exactly. You are very correct there, because this bacteria, this infection, is caused by a bacteria that is actually quite virulent. By that I mean that it is easily spread. Usually infections that are airborne are easily spread. And when you look at the places you are talking about, Kano, Lagos, like you said, they are commercial centers where you have traffic of people coming in and out on a daily basis. So if that is in place, you should understand that when an infection like this is having its base there, then it has a potential of spreading wide. And unfortunately, I was reading through an article that actually even showed Kano State again having a very poor coverage in terms of its vaccination rate. And that is another drawback for us as a people, because this already places us steps backward from being able to curtail this menace that is currently threatening the health of the people of the nation. So I think that the epicenter, which is Kano and Lagos as it were now, actually is a pointer that it has a potential of going to the nook and cranny of the nation. So it's something to be taken very seriously.
So then I must ask you, how is
who
the
are those more
diagnosis
at
of
risk? Let's
diphtheria
bring in the
confirmed,
issue
and
of the
who are
doctors as
those
well here.
most at risk of the disease?
Okay, well, the diagnosis is confirmed by culture. What that means is a sample is taken that from the throat, that is from the back of the throat or from the nose. A sample is taken, and that sample is taken to the lab, and then the organism itself is cultured. That is, the organism grows. The lab tries to mimic the natural habitat of the organism, and the organism grows. And then they even go further to demonstrate production of toxins, because it is the toxins of the bacteria that actually cause most of its disease symptoms, the symptoms we see. So they will demonstrate that this bacteria can actually produce the toxin, and that is how the diagnosis is made. Also, a PCR test can be done. That is the polymerase chain reaction, where some part of the gene of this virus, subunits of the gene, can actually be isolated from also samples taken from suspected cases. And we term the case definition for a suspect case is a person who is having respiratory symptoms, cough, sore throat, with associated pharyngitis, nasopharyngitis, laryngitis, meaning inflammation of the airway region generally. And if there is a grayish plaque, something like a deposit in the mouth there, a deposit, we call it pseudomembrane. It's a suspect case, and so for people like that, a sample is taken from them, and then it is cultured in the lab. So if it's for people at risk, children actually from ages 1 to 5 are the most at risk for this infection, and that is why you discover that in the national immunization schedule, there's actually a provision for children in the pentavalent vaccines. The vaccination for diphtheria is captured in it, which is supposed to be taken there are 3 doses are supposed to be taken within the first year of life of a child, and so and that is in order to protect them. And then aside children, although it can affect anybody it can affect anybody at any age group, but children are particularly predisposed to the organism. Then health workers, because they have more they are more in contact, or they come in contact with patients that are suffering from this condition, and because of how easily spread the infection is, they are also at risk, as well as household members of anyone that has the condition. The people that live with the person, the close contact, they stand a great risk of coming down with the infection.
All right, you've spoken about the diagnosis, but many would like to know, in the case of an infection, what is the ideal treatment for the disease, and could be done to reduce the risk of infection?
Okay, for the ideal treatment, likely there's an antitoxin, a diphtheria antitoxin that is given, because like I mentioned earlier, it is actually the toxin that causes the disease. There's a toxin that the organism produce, and it's that toxin that causes all the disease in the body. So there's an antitoxin that is available. But truth be told, it is not readily available. It is not common. It is not readily available, and it's so because of that, prevention truly in this disease entity is better than cure. Also, we give antibiotics, which are available, erythromycin and others. We give antibiotics, and they are also helpful. And that is a way of prevention too. Usually, when someone is a suspect or has been diagnosed with diphtheria, then the close contact actually are given antibiotics. We call it chemoprophylaxis. So they are giving these antibiotics for them to take to prevent them from coming down, even when they are not having symptoms yet. So you give them these antibiotics to protect them. And also that people should be mindful. And I think that's one of the places where we will look at the media, we look at the government, that there should be more sensitization actually of the people about this disease condition, so that people are on the lookout. It's not everybody coughing or sneezing. We expect people to have good cough etiquette. And also, when you're around the place, you see someone sneezing, coughing, just maintain that social distance the same way we were taught for COVID-19. Try to maintain that social distance, and then practice good hand washing hygiene. You've gone out, you've shook hands with a few people, ensure that you wash your hands thoroughly. For health workers, they should have a high index of suspicion. A patient is coming to you with symptoms suggestive. Please protect yourself, ensure that you are well protected, and don't expose yourself unduly to the infection. So by and large, then largely, we must work hard on our vaccination, because there's something called herd immunity. Herd immunity is a state, trying to put it in plain terms now, is a state where a large chunk of the population, say 70% of the population, have been vaccinated against a particular disease entity. So that already curtails the spread of the disease amidst that those group of people. So we need to achieve herd immunity. This vaccination has been on for over a decade now, and yet we are not there yet. And so there's still much work to be done in terms of our immunization coverage, such that we ensure that we catch people at critical point. Antenatal point is a good time to educate mothers on the need to have their children vaccinated. And then we can utilize our religious home, the churches, the mosques, to educate people on the need for them to get immunized. And then there should be follow-up catch-up immunizations. So you definitely will miss some at that infancy stage. But when they are catch-up vaccinations, that tries to make amends, or to catch or reach out to those people that were missed at that critical point. And of course, that boils down to quality health financing, because without quality health financing, you cannot even do all of these things. You are talking about the need for personnel, you are talking about availability of vaccines, you are talking about availability of centers where these vaccines can be gotten. So all of these things need to be in place if we want to be serious about tackling this disease entity.
All right, finally, before I let you go, the NCDC has rolled out measures to check the spread of diphtheria in terms of surveillance and response on the part of citizens. How can diphtheria cases be managed?
Okay, majorly the role that everybody needs to play, because whenever there is an epidemic or there is a medical emergency, it is a call for all. It is not for the NCDC alone. It is not for the health workers alone. It's a responsibility of everyone. And it starts with education. Every time I've had opportunity to talk or to a group of people about health, I always emphasize that the average Nigerian has this poor culture of trying to know about health. There are jingles about health. People don't want to pay attention. People don't want to understand what this information is saying. But then you must know. You must know what is happening around you. You must know the symptoms, the signs, and then they're advised to see. So as in your place of work, in your neighborhood, in your religious place, mosque or church, you're seeing someone coughing, advise them, go to the hospital for checkup. It's very important. With that, you have played your own part. If you see someone that is and then we call on people to give opportunities during various outreaches by religious body, educate people. This and this is going on in town. When this and this is going on in town, these are the signs to note. These are the symptoms you would see. Once you see it, please get to the nearest hospital. Of course, the National Center for Disease Control have already an algorithm. There's a plan. There's a system actually to cater for because it's a notifiable disease. So I know that there have been trainings upon trainings and downscaling trainings to equip each local government, state, then local government on how to handle these issues. So once a case is notified, the patient is identified, there are people ready to collect the samples, there are labs where the tests can be done and all of those processes. But it is for the individual to actually get to the nearest health workers where these things can be, where it can get the best care. As far as I'm concerned, I don't know of a system in place to reach people in their houses as at now. So, but I know that when you get to the nearest health center, they would be able to kickstart the laid down principle of you getting the best form of care. So that is what everybody needs to do. You need to be aware of the danger it poses, which is what we are discussing here. You need to be aware of the symptoms that you can see. It can come as skin ulcers, it can come as coughs, respiratory infections that will present with sore throats, inflammation, swelling in the organs in the mouth and all of those things. When you begin to see these things, it's important you get to the nearest health center where you'll be evaluated properly. So I think that is the responsibility each and every one of us owe the general public. Thank you.
All right, now, Dr. Irewolide Bello, Special Registrar, Internal Medicine, Federal Ministry Center, Bida, Niger State. Thank you very much for your time. All right, that's the program. Thank you for watching. I am Mary Kanu. Bye for now.